Well, tonight, record levels at some hospitals in Nevada as the amount of COVID-19 patients doubles compared to last month. Good evening and thanks for joining us tonight. Live at 11, I'm Trisha Keene.
And I'm Ty Quinones. Cases right now, they are surging in our valley. And medical leaders, they are now taking steps to keep beds open for the people who need them the most. And Austin Carter is live outside UMC tonight to explain what exactly is being done there. Austin.
Hey, Trisha and Todd, so here's what's going on out here at UMC. Let's start with the good news. They say that they do have available bed space if there is an influx of those COVID-19 patients. They also say that they have enough PPE, but they say that they have made a decision now to temporarily suspend adult surgical procedures if they are not for an emergency, and that will last through next week.
Unfortunately, it looks like it's going to get worse before it gets better.
The data isn't good. A staggering 230% increase in COVID-19 hospitalizations in the Silver State since the beginning of November. Our average test positivity rate over the past 2 weeks at 21.2%, the highest 14-day test positivity rate since the beginning of the pandemic in the state.
The increase in our percent positivity rate of our cases is why you're seeing that overall increase in hospitalizations.
Dr. Christina Madison of Roseman University says the increase in positive cases trickles down to our hospitals, keeping them below capacity, now more important than ever. The numbers are not sitting well, and Dr. Madison says we haven't even seen the full impact of those who traveled for the Thanksgiving holiday.
It takes anywhere from 2 to 14 days before you start experiencing symptoms. You can be contagious up to 2 days before you ever start showing signs and symptoms. And then on average, people don't really seek medical attention until about 5 or 6 days after they start feeling sick.
Nevada continues to move through a 3-week statewide pause that includes limiting capacity at businesses, among other measures to stop the spread and to not overwhelm hospitals.
Those beds required extremely skilled personnel in order to manage those critically ill patients. And it's not just the healthcare workers, it's the sanitation workers, it's everyone that keeps that hospital up and running.
In Reno, the flood of COVID-19 patients has already hit Renown Hospital. The parking garage now becoming an overflow site for those who do not require intensive care. The CEO of UMC has previously told 13 Action News that the hospital has surge plans in place if more beds are needed.